So glaucoma is an optic nerve disease. It usually affects the peripheral vision initially. It's generally not associated with any pain or headache or those type of symptoms, but the peripheral vision loss can eventually creep more centrally and at that point become much more evident. The type of peripheral vision change that patients have, oftentimes they don't notice, but we can detect on specialized testing. Most of the time, it's not an absolute blind spot in the vision, but it can present, for example, as poor nighttime vision or low light vision. It can present as taking a longer time to transition from walking, from a outside into a dim room or vice versa. Those light and dark transitions can be a little bit more difficult. Sometimes colors and contrast overall just kind of feels a little bit more muddied. In more severe forms, the vision can actually be much more dramatic and folks can actually lose the ability to read or to recognize faces or do other tasks. Sometimes folks can come in and already know that they have a family history of glaucoma, and that's especially important if it's in a first degree relative, such as a parent or a sibling or even sometimes an adult child. Other things that can sometimes flag someone as high risk for glaucoma can include an elevated intraocular pressure, and that's oftentimes checked at just your annual eye exam. The other most common way is sometimes the optic nerve just looks very suspicious for glaucoma. There's some particular characteristics to the way that an optic nerve can look like in glaucoma. And so when doctors see that someone has that particular type of appearance, they oftentimes will either order the screening themselves or maybe send them to a specialist for additional workup. In terms of specific kind of imaging or testing that we do for glaucoma evaluation, they include the visual field test, which is a way of doing peripheral vision testing. We also will do something called an OCT nerve scan, which is a way for us to screen for or measure optic nerve thinning. And then we sometimes will also take color photographs of the optic nerve for comparison. The visual field test is kind of the only way for me as the ophthalmologist to have an understanding of, well, what is a patient seeing and also what is he or she not seeing? And that's really helpful for us to confirm a glaucoma diagnosis because there can be other causes of abnormalities to eye pressure, optic nerve scans, things like that. But there are very particular patterns that glaucoma vision loss follows. And so that's really important for me to kind of confirm the diagnosis. It's also really helpful for us to stage the disease. In particular, one of the things we're looking at is how much of the peripheral vision is involved and how close to the central vision is it getting. And so it's really important to do the testing early on so we can catch it early because unfortunately, while glaucoma is not curable, meaning that we cannot undo the previous damage that's already occurred, it is treatable, meaning that we can slow down future damage and protect the vision that's still remaining.